Hello everyone, this is Raju giving you demonstration on the Norma Occipitalis of the skull and the Norma Lateralis of the skull. As we know, the skull has the views, different views, the lateral view, superior view, inferior view, anterior view and the posterior view. The posterior view is considered as the Norma Occipitalis, in which we can see the bones are articulated with the help of the sutural joints, which are of a fibrous type of joints. The Norma Occipitalis can be seen. Whatever the view we are getting, so we'll discuss about it. The bones which are contributing for the Norma Occipitalis are the two parietal bones. We can locate these two parietal bones. Then the upper part of the squamous part of the occipital bone below this one, the two parietal bones, and the upper part of the squamous part of the occipital bone below, and the mastoid part of the temporal bone, mastoid part of the temporal bone. The visible part only we'll discuss. So this one is the mastoid part of the temporal bone. So these are the bones which are contributing. So we can remember that the parietal bone, occipital bone and the temporal bone are contributing for the Norma Occipitalis. Norma Occipitalis. Here we can see the mastoid process, which is like a nipple-like projection. We call it as a breast-like projection. We call it as mastoid process, which is contributed by the temporal bone. And the sutures which we have to notice here, the sutures is, this one is considered as the lambda. As we know, the mathematical lambda is a lambdoid suture, lambda, reverse y, the lambda. Then occipital side you can see towards the mastoid process, occipitomastoid suture. Here we can see a suture which is between the occipital bone and the mastoid part of the temporal bone. So occipitomastoid suture, and here we can see parieto-mastoid suture, occipitomastoid suture and the parieto-mastoid suture. And we can notice even the sagittal suture also. Other than features, we can see the lambda. This point is called as lambda. Few points we can notice. This one is called as lambda. The meeting point of the sagittal suture and the lambdoid suture, we can call it as lambda. Then between the two parietal foramina, there is a prominent point. We can call it as obilion. Then we can locate the external occipital protuberance here. It's an elevation, prominent elevation, over which we can locate a point over the external occipital protuberance. We can locate a point called as inion, inion. Here we can see the external occipital protuberance, a line which is extending from the center part or the external occipital protuberance towards the periphery. We call it a superior nuchal line. Then there is a possibility of highest nuchal line also, just 1 centimeter above. And here we can see the mastoid, which is a breast-like projection, and over which we can locate the mastoid foramen, the black one. We call it as mastoid foramen. Sometimes in few bones we can get the interparietal bone also. Here there will be a bone. We can call it as an interparietal bone at the level of lambda. Then here the peculiarity of this bone is the sutural bones. In between the sutures also we can find a bone called a sutural bone. Just below the superior nuchal line we can find the inferior nuchal line also. There is a line, we trace this line. Superior nuchal line is more prominent, whereas inferior nuchal line is located here. And superior nuchal line is extended towards the mastoid process. We can trace this line. Now we will see the attachments. The external occipital protuberance is giving origin to the trapezius muscle, and the lower part is giving attachment to the upper end of the ligamentum nuchae. The lower part is the external occipital protuberance. Just below it, we can see the ligamentum nuchae attachment. Then the superior nuchal line, medial 2/3 is giving origin to the trapezius, and the lateral part is giving insertion to the sternocleidomastoid. As the name suggests, the mastoid it is giving insertion to the sternocleidomastoid as well. And just above and to the just above this sternocleidomastoid muscle, you can find the splenius capitis also. Splenius capitis muscle. Then if there are highest nuchal lines, 1 centimeter above the superior nuchal line, we can find the attachment of the epicranial aponeurosis medially, and there is a chance of origin of the occipitalis or the occipital belly of the occipitofrontalis muscle lateral side. In the absence of this highest nuchal line, definitely the structures occipital belly, the occipitofrontalis is attached to the superior nuchal line only. We just overview the Norma occipitalis once again. These are the two parietal bones. In between them there is a sagittal suture, and this is the lambda. Point is lambda and the lambdoid suture. Then external occipital protuberance and the superior nuchal line, and the external occipital crust is continued below. We can study in Norma basalis. After the Norma occipitalis, the continuation below is the Norma basalis. Then we can see the mastoid process. The mastoid foramen can be seen, through which the emissary vein is connected to the sigmoid sinus. Emissary vein passes through that along with the artery. Then here we have seen the attachments of the trapezius muscle, external occipital protuberance, and extended a little bit laterally to over the superior nuchal line, and the lateralmost part of the superior nuchal line gives attachment to the sternocleidomastoid muscle, and there is a possibility of attachment of the epicranial aponeurosis and the occipital belly of the occipitofrontalis muscle. So the ligamentum nuchae also is attached below the external occipital protuberance. This area is covered by the occipital belly and the epicranial aponeurosis as well. Here the next view is the Norma lateralis, in which we can see the bones like the frontal bone, which is located here, then the parietal bone contributing for the Norma lateralis, lateral side view, then the occipital bone, then the temporal bone. This whole part is called as temporal bone. Here the sphenoid bone, then the zygomatic bone, along with the mandible, the maxilla, and partly the nasal bones also contributing for the formation of the Norma lateralis. Here we can see the various features of the Norma lateralis. Here we can see first from this area we will trace the superior nuchal line, superior temporal line, superior temporal. Two temporal lines can be located, superior temporal line and the inferior temporal line. Superior temporal line, here we can trace superior temporal line, a little bit fading, and it is traced towards the zygoma. So here it is a supramastoid crust, it's continuing with this one, and this one is the zygomatic arch. Even in our body also we have to locate these areas. For example, surface marking of the Norma occipitalis, we can locate the external occipital protuberance prominently. Then regarding the Norma occipitalis, just in front of the tragus of our ear, we can locate an arch. Just below it, we can locate by clenching your teeth. We can palpate the masseter muscle and the temporalis muscle as well, which is occupying the temporal fossa in our body. So here we can see the peculiar features. Here we can see this is temporal fossa, external acoustic meatus, and this part is considered as the infratemporal fossa. Now we are tracing the temporal line, superior temporal line. It's a continuation along with the supramastoid crust, and This one is the zygomatic arch, which is contributed by the temporal process of zygomatic bone and the zygomatic process of the temporal bone, this one, and they are joining with a joint called as zygomatico-temporal suture. There are the certain points called as anterior end of this upper border is considered as a jugal point, and just below the lower border if you are tracing, this one is the articular tubercle of the root, we call it as articular, the lower border of the zygomatic arch we are tracing, articular tubercle of the root, and just behind it here we can see there is a fossa which is meant for articulation of the mandible, condylar process of the mandible will articulate here and they form a temporomandibular joint. So this is articular fossa. Just behind it also we can find one more tubercle called as postglenoid tubercle. And here we can see the external acoustic meatus, and above which one prominent feature we have to locate called as the suprametal triangle, called as another name for that same is the Mc-Evans triangle. MC, capital M, small c, and EWEN, Mc-Evans triangle. Here we can see what are the boundaries of this Mc-Evans triangle. We'll have a look. Here we can see the superiorly the continuation of the supramastoid crest, and inferiorly you can see the outer border of this external acoustic meatus, and by connecting these two lines we draw a tangent line. So this much part is considered as a triangle. We call it a suprametal triangle, otherwise the triangle of Mc-Evan or Mc-Evans triangle. I repeat, supramastoid crest continuation, this line, one horizontal line, and the outer border of this the external acoustic meatus, and by connecting these two lines we draw a tangent line. So in between them there is a triangle which is have a surgical importance, Then along with that we can see the styloid process also. After removing the mandible we can locate the styloid process. As we know the word stylus to locate, or by using in Android mobiles we can use the stylus to operate the mobile. So stylus means pen like projection is called as the styloid process. Then what about the temporal fossa? Here we can locate the temporal fossa. Above it is bounded by the superior temporal line, and below the upper border of the zygomatic arch, and the anterior wall is formed by the zygomatic bone and the partly by the frontal and the sphenoid bones as well. Here you can see the anterior boundary, the superior temporal line, superior boundary, anterior boundary, zygomatic bone along with the frontal and the sphenoid bones, and the inferior boundary is by the upper border of the zygomatic arch laterally and infratemporal crest of the greater wing of the sphenoid bone medially and all. So these are the boundaries inferiorly. This is totally considered as the temporal fossa. And here the floor is the anterior part of the contributed by the anterior part of the floor of is crossed by, this is the floor we consider totally floor. The floor is crossed by an H-shaped suture. We call it as a pterion. Here there is a coronal suture. Here between the temporal and the sphenotemporal, then parieto-temporal and the fronto-sphenoid. In between them there is a horizontal line also located, suture. So totally it is appearing like alphabet H. So H-shaped suture we call it as pterion, P-T-E-R-I-O-N, pterion, and which is usually clinically important above midpoint of the zygomatic arch, 4 cm above this zygomatic arch, 4 cm above the zygomatic arch we located, and 2.5 cm behind the fronto-zygomatic suture, 2.5 cm behind it. So what about this point? It's clinically important because of during accidents commonly this area will be injured. Deeper to this there will be middle meningeal vein and the anterior division of the middle meningeal artery along with the lateral sulcus of the brain also located. So whenever there is an injury there is a chance of intracranial hemorrhage and the bleeding as well. As we have studied already, the mastoid process is located here. It is Pareto mastoid suture is located here, and the occipitomastoid suture also located here. And here we can see the just nearby the occipitomastoid suture we can find a foramen called as mastoid foramen. Already we have discussed. The emissary vein connects the sigmoid sinus. And regarding the attachments, the superior temporal line giving us attachment to the temporal fascia, which is occupying this whole area, and the temporalis muzzle is taking origin from this whole temporal fossa. It's occupied by clenching our teeth also we can palpate just above the zygomatic arch. This is a temporalis muzzle, and along with that there will be just below the muzzle we can find the deep temporal vessels and now the middle temporal vessels also. And the inferior border of the zygomatic arch is giving origin to the masseter muscle. This is the inferior border of the zygomatic arch. And tubercle of the root of the zygoma is giving attachment to the lateral ligament of the temporomandibular joint. And as we know, the superior occipital or from the occipital region, superior nuchal line continues and is giving attachments to the sternocleidomastoid towards the mastoid even extended, and the splenius capitis and the longissimus capitis are inserted from before backwards from the posterior part of the lateral surface of the mastoid process. So this is about the attachments of the sternocleidomastoid, splenius capitis and the longissimus capitis. Then what about the gap between the zygomatic arch and the side of the skull? Zygomatic arch and the side of the skull. What about this gap? This gap is totally filled with the temporalis muzzle and the deep temporal vessels and the nerves. And here we can see even the pterygopalatine fossa. This is called as pterygopalatine fossa. Here we can locate the pterygopalatine fossa. Will be studied later in detail. You can locate the tympanomastoid suture through which the auricular branch of vagus nerve will pass. And the mastoid foramen transmits the sigmoid sinus, the emissary vein which connects the sigmoid sinus with the posterior auricular vein. And the zygomaticotemporal foramen also to be located. Zygomaticotemporal foramen transmits the nerve of the same name, zygomaticotemporal nerve. And a small artery also can be passed through this one. What about the pterion? The clinically important pterion point is very important for in the roadside accidents we can see, already we have discussed about it. So there is a possibility of injury to the middle meningeal vein and the lateral sulcus even, and the artery also. And there can be, from inside if you observe, there will be impressions of these vessels over the skull. So that makes the pressure, because of the blood pressure, so that the vessels impressions can be seen. So just we review once again the norma lateralis. Here you can see the coronal suture. This is a pterion point can be seen properly. The superior temporal line, the zygomatic bone, the zygomatic arch, superior border, inferior border, and tubercle, then postclinite tubercle, the articular fossa, then the temporal fossa, then the floor of the temporal fossa, the anterior wall of the temporal fossa, and the suprametal triangle, external acoustic meatus. Suprametal triangle is bounded by the supramastoid crus and the outer border of this external acoustic meatus, and the tangential line connecting these two is called as, it's forming a triangle called as McEwen's triangle, suprametal triangle. And we remove the mandible, we will see the styloid process even. After removing the mandible, we can see the pterygopalatine fossa here, maxilla and the pterygoid plate, and here the styloid process also can be seen clearly, and the mandibular fossa. Here we can see external acoustic meatus more clearly and the mastoid process more clearly. So this is about the norma occipitalis and the norma lateralis in brief. Thank you very much, and for further reading. You can refer the books. It's a basic information. Thank you very much.